Welcome back to the podcast and YouTube of Everyday Health Hackers with Dr. Lisa Leal and Mike Hertzing. I want to thank everybody for all their comments and questions regarding osteoporosis. We've had a lot of new subscribers, and I just want y'all to know how much we appreciate it. And one of the questions that we had, and I want to really delve into today, is about the about osteoporosis and bone quality and how we can increase our bone quality with supplements and minerals. So stay tuned.
Welcome to another edition of Everyday Health Hacker. I'm Mike Herzing along with Dr. Lisa Leal.
Hi, Mike. Welcome back.
Welcome back. It's good to be anywhere. All right, folks. Dr. Leal is Chief Medical Officer right here at Meridian Health Institute in Sugar Land, Texas. And our goal is to provide you with health information to help so that way you can make informed health decisions. And it's a pretty big deal. I'll tell you what, it's going to cost you a lot of money and we can save you a lot of money and you can do the right thing. With a little knowledge can really make a difference. All right, Doc, we've got a lot. The other day we did 3 episodes on osteoporosis, and we generated a lot of emails. And folks, we do listen to your listen to your emails. Okay, listen to your input. How's that?
There you go. We
read your emails. Actually, she does, and that's the most important thing. And we've got a lot of what are some of the emails saying?
You know, some of the comments were, and I really like this one because we have it up and coming, which is what about the supplements, minerals, and what you can do in order to build bone quality. And I truly appreciate that the viewer, talked about all these different ones. So I wanted to say, hey, let's kind of delve into it a little bit more. And, this is kind of, it may be a repeat for some, and for some, it may be new information. I think it's very important information, and I want to thank the viewer for sharing this. Yeah. And, one of the first things I wanted to talk about was medications. A lot of our viewers are already on medications, and they're taking supplements. However, these particular medications can block the absorption of the supplements that we need. So I wanted to kind of go in and kind of review some of those.
Well, some of these medications, you don't know what the interactions are. There were some of the other questions we had gotten about interactions. Sometimes you can probably do a blood test and go, okay, I am absorbing this, I'm absorbing that. Oh, wait, I'm not getting this.
Right.
And I remember taking a bunch of vitamin D supplements, and we went and checked my vitamin D and it was like, my levels are low. And I went, I'm taking a boatload of supplements.
Right.
What's the deal? And
we went through.
Let me go back and look. Okay, well, some of these other supplements are blocking that.
Correct.
Well, we need to try to go back and circle around. And this is what you're talking about, right?
Exactly. Because, a lot of times we'll take medications, a real popular pill. We used to call it the purple pill, but it's an H2 blocker. H2 blockers are similar to Nexium, Prevacid, omeprazole. Some of these are over the counter now. And they are also prescription. Pantoprazole is another one, just to kind of name a few. And these actually will block your ability to absorb in the stomach your B12 and your calcium. So that causes a problem. And let's say that you're taking your calcium and your B12. So what I share with patients is that if, let's say that they have an ulcer and we're treating them for this, we'll just change the timing of when they take it. A lot of people take their H2 blockers in the morning. And by the way, H2 blockers are meant to not be taken for more than 3 weeks. So if you've been on it for longer than 3 weeks, don't stop it abruptly because it'll cause rebound. And rebound means that all the acid comes back and just a huge force of nature. So be really cautious and talk to your doctor about how to slowly decrease.
Okay, yeah. So basically you can't just jump on and off these things. You've got to ease yourself off, and you need to talk to your medical professional before you do that. That's a big deal.
Exactly.
And
one of the more common ones, is, people are calling, it's, flu season right now. So people are calling, they're having GI issues. It's going up, it's going below. They're just not sure what to do with it. A lot of providers out there are starting them on medications, and those medications will also, even though they're maybe only be for 5 or 7 days of treatment, they're going to interact with these minerals. So you have to be cautious with them. So let's go over, like statins will cause that. Antibiotics and also antivirals can cause a decrease in absorption of these different vitamins and minerals. So let's dig in and talk about the vitamins and minerals.
But also, maybe when you're taking all these extra supplements and stuff, you need to mention it to your physician.
Absolutely.
Or the people that give you your medicines. So, by the way, I have gone back and started to take this, and supplements. Is this going to affect anything that I'm doing?
Correct.
You're thinking these are vitamins and supplements. It can affect real medicines. But it really
However
does,
they
doesn't it?
do, because you would never take your thyroid medication with a lot of your supplements because it'll counterbalance it, and you don't want to do that because you need your thyroid. So
Mm.
it's all about timing. It's
Would it
all about
be
timing.
maybe an hour before, an hour after,
Um,
or hour and a
for
half?
like magnesium and calcium, I'll always share with patients, just take it on the opposite end of your 12 hours. So
Oh,
if you're
okay.
taking your thyroid in the morning, take those supplements in the evening. If you're taking your thyroid supplement in the afternoon, and a lot of people actually take thyroid supplements twice a day because they may not have a thyroid at all. It may have been
Oh, okay.
surgically removed. So it's finding when to take it. And for some patients, I'll put them on calcium that will actually be best absorbed with a meal. So we'll time that with lunch.
Oh,
So different ways of doing that. It's
all
just
right.
about timing.
So it's all about timing. All right.
Mhm.
We can't necessarily don't have to quit taking it. We just have to take it at the right time.
At the right time.
Got it.
You know, let's say it's like this too regarding like pain medication. Patients will say, I'm minimally taking this, but then at night I have to take extra. It's like if you take it on schedule, and I'm talking about like after a surgery, this is an acute problem, is that you should take it at a standard timing every 6 hours, every 8 hours, and then wean slowly from them by spacing it out. If it's a chronic illness, we do the same thing. It's all about timing because we want to take the least amount of medications. And I would rather people be on all supplementations if that's possible, but that's not possible for everybody.
Because there's a lot of people who say, "Well, I just took this and it didn't seem to work as well after I've had my breakfast and then I take the medicine,
Mhm.
or I've take the medicine and then I wait a while and then I have my breakfast." I said, "Well, you need to find out which one you're
When
supposed to do,
exactly,
and because it makes a
exactly.
big difference. Some medicines work great if you take them on an empty stomach, and then you wait a little while and then eat."
And
Versus, and some of them you want to take it with the meal, otherwise it's going to upset your stomach. You got to
exactly.
figure out which one it is.
And some medications make you tired, so we want you to take those at night. A lot of high blood pressure medications cause people to be tired, so we want them to take it at night so that that side effect that they need the medication and we need to. And that's a whole new
So
arena
that's
about where your blood pressure should be.
That's a whole bag of worms.
Yeah, it
Yeah,
is.
it,
That
it
is. We'll
sure
talk
is.
about that
All
soon.
right. So let's go back. Now that I've distracted you, led you on a whole
Shiny
nother.
ball.
Yeah, there you go. Squirrel. Yeah, that's it. All right. Where were we?
So let's go through like
Okay.
what can we do to increase our bone quality? And we've talked about a few of these before already, and we talked about our vitamin D3.
Hmm.
And I'd shared before, vitamin D is better absorbed when you have K2 with it. So look for a supplement that has both.
Yeah.
Your B6 and your B12, and remember those are not absorbed if you're taking an H2 blocker, a statin, and many other medications. So know the timing of when you should take these. Vitamin C, I always say take it first thing in the morning, just because your vitamin C is just a wonderful way to start your sunshine of the day. And again, if you're taking thyroid, you need to wait a little bit of time. And I always share with patients, they're like, well, how long is a long time? Like, a minimum of 45 minutes.
Okay.
However, with thyroid, we actually recommend 2 hours.
Oh.
And that's hard to do. That's really
Yeah.
hard to do. So,
Yeah,
but it can be done. And
unless you wake up an hour before you wake up and take an alarm and say, "Let me take my thyroid now," and then kind of nod off back to sleep and get up and take a shower and then take your.
Yeah, take it first thing is what I always say. Like first, as soon as you wake
When you
up,
open your eyes.
go and get ready, go work out. And then by the time you're making breakfast, you've already got that 90 minutes to 2 hours already out of the way.
Got it.
So that's a couple of things. So we talked about vitamin C, D3, B6, B12, K2. And then what about calcium, selenium, trace minerals like manganese, zinc? These are all very important. And, some people have difficulty with just the basis of the water that they drink. A lot of people drink bottled water. And there is a difference between distilled water and water that has electrolytes.
Mm-hmm.
And a lot of these waters also have trace minerals. So I encourage you to do a little investigation. And then some people might be drinking groundwater that's coming off, it's going to be different groundwater than what's going to be in Texas compared to Colorado and having the mountains. So all of those come into play for your bone health.
Yeah. Some of you see your water and you'll look at your at the water spots on your windows, on your cars, and things
Mhm.
like that. You go, okay, that's in me.
Mhm.
I'm grown up with that. Okay, it's fine, but it may not be.
Correct.
And distilled is taking all that out, and maybe it's good for you. And so you need to figure out what works.
And water is a multi-billion-dollar industry.
Yep.
Not all water is created equal. Distilled water is what we use to. I always think of automotive with
Right.
distilled water because everything
With your
your
coolant,
batteries. If you've
your
got to
battery
add,
with your
you've got to add
coolant,
distilled
yeah.
water. If you add electrolytes, you're going to have a problem later. So don't do that.
Yeah.
And same thing within your body. You need the electrolytes and not the distilled water, especially in summer heat. you need a lot more electrolytes. So we're actually pouring electrolytes into our water
Yep.
so that we get
Pedialyte.
extra. So
Pedialyte,
Pedialyte,
Propel, all that good
all
stuff.
of those, just make sure that they don't have sugar, okay?
Right. That'll make a difference. So it all makes a difference.
Mhm.
But I can tell you, just plain water, I said Brook Shields and those
Uh-huh.
kind of things, it's not quite enough
It's
if you're sweating a lot.
It's not enough, and that's where they have these wonderful electrolyte packets. And a lot of these electrolyte packets will have vitamins, minerals, and supplementation that you can add. So it makes it really easy because we need to drink water anyway.
Mhm.
And I always share with people, they're saying, I drink 4 bottles of water. I'm like, how big is that bottle? Because, it might be a big one. However, they're usually these tiny little ones. So I encourage lots and lots of water.
Well, we go. So if anybody has any questions, info@everydayhealthhacker.com will get that email will get its right to her.
Or just comment on the page. We'll get those too.
That too.
We check those, and you'll have about a 48 hour at most return comment. And just as a recap for osteoporosis, for building your bone quality, it's going to be vitamin C, your vitamin D with K2, preferably vitamin D3, your B6, your B12, calcium, magnesium, manganese, selenium, and watch out for the other medications that you may be taking and get the timing down so that they're actually absorbed into your system.
There may be a test on that later.
Have a super blessed day, and we thank you for joining us today. And again, this is another part 4 of our podcast and playlist on osteoporosis and being safe.
Have a great week.